Like my state, they call it a swing state. It's a swing state. We have voters that we represent that are Republicans, Democrats, Independents, and it really isn't about your party. It is about health care and access to health care in this country. And so for my colleague from Michigan, I am curious what she is seeing and the impact that the Medicaid cuts that we are talking about would have to your constituents, the people that you represent in Michigan.
Thank you, Senator, and thank you, Mr. President. I mean, I think what we're all here talking about into the dead of night is this idea of who we want to be as a nation when it comes to providing health care. Do we believe that the greatest country in the world should be able to treat the people who need help in our country, or are we okay with the poorest among us, the weakest among us, those who are disabled, those who are elderly, those who are children, just not having access to care? And as you said, when you look around at the math, right, this isn't a political statement, the math of needing to find $880 billion with a B, the math just doesn't work without gutting Medicaid. And I think it's important to understand, at least in my state, that this isn't just about people who have Medicaid as their primary insurance, right? We have 10 million people in Michigan, 2.6 million people are on Medicaid. The vast majority are children, right? People who can't live up to work requirements, people who just happen to be, young people who happen to be born where they were born. 37% of all our births in Michigan are handled and covered by Medicaid, and 2 out of every 3 nursing home elderly are covered by Medicaid. So it's not just about the people who are receiving direct care, it's about what Medicaid reimburses and funds. The idea that 65% of our nursing homes could potentially go under if they don't get this funding. The idea that our rural hospitals from Hillsdale to Marquette, Michigan, have come to see me and they say, look, we're not Democrats, we are conservative people, but if you take away this reimbursement, we will collapse. They're already suffering after COVID, they're barely hanging on. So access to rural hospitals is something we're deeply, deeply worried about. I think the bigger question is, who do we believe we are, and do we have a commitment to serve and protect and provide basic health care to people in our states? Now, you mentioned this, but I think it's important to realize that with a number that big, we're not just talking about Medicaid. There's real risk of Medicare Part D being touched, the prescription drug piece of that, and the Affordable Care Act, which so many people depend on, the many, many people being cut off from that at the end of the year. The math just doesn't work. And so what we're really talking about is, in the state of Michigan, in the United States, the potential for either people to lose their coverage or to have the price of their coverage go up. Because everyone talking about these Medicaid cuts back home has also mentioned that, by the way, if we don't get the Medicaid reimbursement at our hospital, I'm just going to charge more to the people who have insurance. There's going to be more people in my ER. I'm going to have to pass that expensive price off to customers who do have health insurance. So it's just important to understand the full spectrum of what we're talking about here. Now, I'm sure you've heard a ton of personal stories, right? It's important to understand we're giving a talk on the Senate floor, we're talking about numbers, but at the end of the day, this is human beings. And I'm sure your phones are flooded, as mine are, with people who want to tell their personal stories. And I will say, for me, it feels like Groundhog's Day, because I decided to run in 2018 for the very issue of health care, because I happened to live through my mother getting stage 4 ovarian cancer without having insurance. She had no insurance. And that first month of that terminal diagnosis, where you're desperate to get her tests and coverage and some kind of emergency surgery, you're using your credit cards, you're doing whatever you can while you're just feeling completely lost, that you know your mother is going to die. That feeling is the worst feeling I've ever experienced, and it's what we're proposing to millions of additional Americans by the end of this year. So I'm sure you've heard a lot of personal stories on your phones. I don't know if you want to walk through a couple of those stories, but I think it's important to make it a human issue, not just a numbers issue.
And that's right. And I think my colleague from Michigan, because it's true. I mean, I can tell you in February, I spoke with Madison from Nevada. She has stiff person syndrome. This is a disease that impacts all her muscles and her breathing, and she has to be on a ventilator 7 times. She wouldn't be here today without Medicaid, which provides her with home health care. And Madison's sister, Tricia, was with her that day when she had to deal with such, and this is trauma. This is such, healthcare is trauma in somebody's life. If Madison's Medicaid coverage ends, she would have to go live with her sister and depend on her for care. She'd be forced to move away from her community and her whole life. Madison needs really Medicaid to live her life to the fullest. And like my colleague says from Michigan, these are real people that will be impacted. And I know she's seeing the same. I do want to pose to her this thought, though, of it's not just the individuals. We know there's real life impact, and we see it. We hear it in our offices. We are getting those calls. We're meeting with individuals. We know them. We know them. They're our neighbors, they're our friends. We know them when we're home. Here's the other thing people forget, though. I know in Nevada, we already don't have enough providers in Medicaid. We don't have enough providers in the program to begin with. And expanding the number of healthcare providers in Nevada, it really has been a priority of mine, and that's why I am leading legislation, bipartisan legislation, with my colleague, Senator Cassidy from Louisiana, to support graduate medical education programs. But here's the deal. If Medicaid funding in Nevada is cut, not only will those rural health clinics close that I talked about, but here's the thing people forget. We would have fewer providers because they would be incentivized they would not be incentivized to come to my state and treat patients. They're going to figure out where they can go and still survive. Remember, our providers have to still survive and make a living, and they want to treat patients. And so we are going to have a provider issue in my state. And I don't know if that is an issue for Michigan, but it is something that goes hand in hand with these Medicaid cuts, because I hear from my providers as well.
Yeah, I mean, we talked about rural hospitals. I think, again, even if you're not on Medicaid, you've never signed up, you've never been at a low point in your life where you've needed a bridge, you've never had a child with a disability, you've just never touched the system. I guarantee you the hospitals that you depend on, the clinics that you depend on, the nursing homes that you depend on for your mom, your dad, are dependent on Medicaid. I guarantee it. And what we're hearing from our rural hospitals is, look, we're the only hospital in 3 hours where you can get care. If we go, where do our people go? Where do we tell them to go? If you're delivering a baby and you have to come off the Upper Peninsula into the Lower Peninsula of Michigan, there is just no way that we can function that way. So it's not just about as you say, individuals, although those stories are striking. It is about access to care for everybody. I was talking to a doctor from the Lansing Carefree Medical Clinic. It's completely Medicaid covered. It is the folks who are left out of the system, he will just close. I mean, we'll have clinics just close. So I think we're talking about something that, again, comes to the heart of like who we are as a community. I will also just say, I think it's important to put a warning label on it, and then I'll turn it to you to maybe finish out, is there's a lot of magic math going on right now on the other side of the aisle, right? How do you take a group of people who both want to cut Medicaid in a devastating way, want to cut other health care in a devastating way, and match them up with a bunch of people who say, I can't, colleagues on the other side of the aisle who said, I can't accept cuts like that? How do you balance two completely different factions in the same party? And it happens, right? What normally we would see is tough choices being made, right? Either the other side of the aisle is going to acknowledge we have to make these devastating cuts, or they're not going to cut them. But what we see now is the third secret option, which is magic math, which is we're going to tell you we're not cutting anything, but we're going to quietly make the math just work so that we are actually cutting all these things. We are able to reap the benefits, or we push those cuts out to the out years, right? So you don't notice them today, but maybe later, maybe after other elections, you're going to feel those Medicaid cuts. So it's just my big warning label on the whole story here is that there's magic math going on from beginning to end on this package, and don't be fooled. They are coming for your health care. You are either going to be paying more or you're going to lose your coverage. That's just a fact based on the math that they've put out publicly and voted on today. So I thank my colleague for the opportunity to do my first colloquy. I didn't know this was a thing that we could do. Thank you for giving me that opportunity, and I'll let you finish us out.
Thank you, from great senator from Michigan. Let me say I'm so pleased that she brought this up because it is a gimmick. The gimmick that they're playing right now is somehow that these $7 trillion in tax cuts that they want to give to billionaires is not going to add to our deficit or debt. Remember, these are the Republicans, the party of fiscal responsibility. And it's not going to add to our deficit or debt. This is a perfect example. I read this in the papers. Perfect example of what this means. This is like you're a parent and you have put your daughter through college for 4 years. And she comes